So today on Road to 250, I'm going to talk about some stomach physiology and the GI hormones. So to start off with, I am going to just review a little bit of GI overview, kind of outside the box sort of picture. So the oral phase, or the oral cavity, consists of alpha amylase, which is an enzyme secreted by the salivary glands, and it begins the digestion process of the starch. Specifically, the R protein from the salivary glands promotes the absorption of vitamin B, so it starts as early as when food touches the oral cavity. In terms of the esophagus, contraction of the muscles of the pharynx initiates swallowing by a moving bolus of food into the esophagus. And then peristalsis, which is going to be involuntary contraction, assists in moving the bolus from the superior aspect of the esophagus into the lower esophageal sphincter. And then the lower esophageal sphincter must relax in order for food to move from the esophagus into the stomach. So here's a picture, and here we see the oral cavity with alpha amylase. Remember that the absorption of vitamin B begins as soon as the oral cavity phase. And then in terms of esophagus, the contraction of the pharynx will allow for the beginning of moving the bolus down into the esophagus. All right, so for the stomach, I'm going to start off with gastric cells. So this includes parietal cells, which are located at the body of the stomach, and they secrete hydrochloric acid, so HCl, an intrinsic factor. Chief cells are also considered a part of gastric cells. They are located in the body of the stomach. They secrete pepsinogen, which gets cleaved into pepsin in the acidic environment of the stomach. And pepsinogen begins the process of protein metabolism. Mucus cells are also located in the antrum of the stomach. They secrete the mucus responsible for the protective barrier near the gastric epithelium. G cells are also located in the antrum of the stomach, and they secrete gastrin, so G cells, G for gastrin, which stimulates the parietal cells then to secrete acid. So G cells, which secrete gastrin, work in parallel with parietal cells to secrete acid. The D cells are located in the antrum of the stomach, and they secrete somatostatin. And stem cells are present also at the base of the gastric pits and are responsible for replenishing the gastric epithelium. So here, this picture shows us starting from the parietal cells, which again secrete acid and intrinsic factor. And then the chief cells, which secrete the pepsinogen. Mucus cells are here in the antrum, which create the protective barrier. G cells here are going to release the gastrin, which then stimulates parietal cells here. And D cells here secrete somatostatin. And then stem cells are not pictured, but they're just a purpose for replenishing the gastric epithelium when in need. The picture on the right is showing the R protein that I spoke about in the very beginning in the oral cavity. The R protein the R protein is a byproduct of the breakdown of the digestion of the starch, and it's created from the salivary glands, and it promotes absorption of vitamin B12. So B12, and there's like animal protein, or like pretty much what we're gaining from our intake of food, and then our protein is secreted and will attach to B12 as the digestion process begins. Just like a small minute detail to, I guess, keep in mind if it ever comes up in question. All right, so the function of the stomach. So intrinsic factor, so there's three functions. First is that intrinsic factor secreted by parietal cells will facilitate B12 absorption, which is ultimately absorbed in the terminal ileum. Two, the stomach serves as a reservoir, which regulates how frequently boluses of food can enter the duodenum. And then three, acid secretion, on which facilitates then protein digestion. So again, the parietal cells are found in the gastric mucosa. They produce acid. Acid is secreted into the lumen of the stomach in exchange for potassium. And this is the primary active transport pump, which requires ATP, by the way. So that is how that process will take place. And then acid secretion occurs in three phases. So first, the cephalic phase of acid secretion is mediated by the vagus nerve and is triggered by taste, sight, smell, and the thought of food. The second phase is the gastric phase, and it occurs as a result of food entering the stomach, which causes the release of gastrin and subsequent stimulation of histamine and acid secretion. And then third, the intestinal phase of acid secretion occurs when protein enters the duodenum. So although the initial part of the phase stimulates acid secretion, the overall effect is to reduce the acid secretion. So this occurs as the ileum and colon release peptide YY, which acts on the enterochromaffin-like cells and inhibits the release of histamine. So to give this a more visual representation, the cephalic phase, again, of acid secretion is mediated by the vagus nerve, and it's triggered by taste, sight, smell, thought of food. The gastric phase is food entering the stomach and the release of gastrin as a result. The release of gastrin is also then stimulating histamine. Histamine stimulation, as you can see. And then the intestinal phase is where secretion occurs when protein enters the duodenum. So this occurs as the ileum and the colon are released and protein YY acts on the enterochromaffin cells. We talked about a little bit earlier in that parietal cells are found in the gastric mucosa, and they produce acid, and it's this is the ATPase pump that I spoke about, in that acid is secreted in exchange for potassium, and that's the primary active pump. And then this is just a histological slide of a normal stomach cell. So factors that protect the stomach against the acidic environment. So that would be highly vascularized epithelium, allowing the blood to sweep away any excess acid. And then mucus barrier that provides acid from eroding the tissue. Bicarb secretion from the gastric epithelium into the mucus layer is also neutralizing the acid that reaches the barrier. And then prostaglandin E, PGE, is also facilitates bicarb and mucus production. So those will be all the factors that will help create a protective barrier against the acidic environment. And then lastly, some other stomach functions include the small intestine, which consists of the duodenum, jejunum, and ileum. And then the large intestine, the normal flora of this, or the normal flora in the colon, produce folate and vitamin K from undigested sugars, which also protect the mucosa from pathogenic bacteria. So that would be the purpose it serves. The large intestine is especially prone to developing diverticula when intraluminal colonic pressure increases. So it kind of weakens the wall, and then increased pressure will then cause outpouching. Any questions so far? One thing I can... so in this picture, the histological slide, Okay. So let me see. This part here to here. So in between the two yellow lines, that's going to be the parietal cells, and then this darker purplish line, so the second layer is going to be the chief cells. All right. Any questions?
No.
All right, so then moving forward into GI hormones. Okay, so starting with CCK. CCK is produced by eye cells in the duodenum. It is stimulated by fats and lipids, and it aids in fat digestion, therefore. So when the gallbladder contracts and the sphincter of Oddi relaxes, there is a release of bile, and that leads to emulsification of fat. Pancreatic secretions will include enzymes that specifically also aid in breakdown of fat. So CCK will stimulate these functions. And again, CCK will then also stimulate gallbladder and pancreas for these functions. And then overall, it decreases the gastric emptying and increases satiety as a result. And CCK, again, is released from the duodenal eye cells in response to fat entering the duodenum. All right, secretin. Secretin is produced by the S cells in the duodenum. It is stimulated by acid and fat. The functions are to decrease the acidity and improve function of the pancreatic enzymes for breakdown. So it does this by stimulating the chloride bicarb antiporter in the pancreas, which increases bicarb in the intestinal lumen and increases the luminal acidity. And it will also decrease gastrin secretion from the stomach and the duodenum, which decreases the proton release, which increases the luminal pH. And then increased bile production will increase fat digestion. So this is what secretin aims to function to do. Glucose-dependent insulinotropic peptide, or GIP, is produced by the K cells of the duodenum and jejunum. It's stimulated by fat cells, amino acids, and oral glucose. And it aids in the digestions of fats and amino acids and the absorption of glucose. So that's pretty important. GIP stimulates release of insulin from the pancreas and which then leads to increased absorption of glucose that has come in through that initial bolus. So like we know, release of insulin pushes glucose into the cells. So that's what's doing there. And then there's also decreased acid secretion, which will ultimately improve the function of the pancreatic enzymes. Motilin. Motilin is released from the small intestine, and it's increased while in a fasting state, and it functions to clear the small intestines in preparation for the next meal. So motilin equals movement, and it is responsible for the migrating motor complexes, MMCs. VIP, or vasoactive intestinal peptide, is released from the parasympathetic ganglia by a parasympathetic stimulus, and it functions to increase fluid and flow in the intestines. So it does this by relaxing intestinal smooth muscles, which will increase the electrolytes and water to enter into the lumen. And relaxation of the sphincter of Oddi, which is assisted by CCK, will increase the bile flow. A common pathology associated here is a VIP-oma, which is oversecretion of the VIP hormone, and it leads to WDHA syndrome, or watery diarrhea, hypokalemia, and achlorhydria syndrome. Enkephalins. Enkephalins are released from neurons throughout the GI tract. It causes constriction of smooth muscle, and so therefore there will be decreased fluid flow into the intestines. And opiates actually act on enkephalin receptors, and they decrease the fluid flow, and then which leads to constipation. Somatostatin. This is produced by the D cells in the GI mucosa. It's stimulated by a low pH, so a acidic environment, and it's inhibited by vagal stimulation, so if we're in a parasympathetic state. It does inhibit the release of all GI hormones and pancreatic secretions to maintain hormone balance. So secretin from the S cells is decreased, and decreased bicarb therefore is released from the pancreas, or less bicarb is released. The stomach hormones, there's going to be an overall decrease in the acid production. In terms of pancreatic secretions, there's going to be decreased insulin, glucagon, enzymes, and bicarb, all things that are usually released from the pancreas. The CCK from the I cells will decrease gallbladder contraction because it won't be released, it'll be inhibited. Inhibition of GIP from the K cells will result in decreased insulin, and inhibition of motilin and VIP will overall decrease fluid and peristalsis. So any questions so far?
No.
Okay. So I have some for you, just a few. So a 57-year-old man undergoes resection of the distal 100 centimeters of the terminal ileum as a part of his treatment for Crohn's disease. This patient will likely develop malabsorption of which of the following?
B.
Did you say B for boy?
Mm-hmm.
Okay. Anyone else?
E, protein?
Okay. So the answer is actually bile salts, and I know I didn't review this. It's just like a trick question, or I guess a question to see if you, or just to kind of jog our memories. The reason being is that the terminal ileum contains specialized cells responsible for absorption of primary and secondary bile salts by the active transport. And actually resection of the ileum will then prevent absorption of bile salts, which will lead to steatorrhea. Are any like questions? I mean, we can go over, so iron is absorbed where?
Duodenum.
Yeah, iron is absorbed in the duodenum. Folate is absorbed in. Lactose is going to be like your microvilli. And then protein. I mean, I think protein is more so like breakdown, not being reabsorbed.
Yeah, it's in first aid.
Yeah. So I guess by a process of elimination, bile salts would be the best answer here. Okay. One more. A 42-year-old salesman presents with chief complaint of intermittent mid-epigastric pain that is relieved by antacids or eating. Gastric analysis reveals that basal and maximal acid output exceed normal values. The gastric acid hypersecretion can be explained by an increase in the plasma concentration of which of the following? Somatostatin, histamine, gastrin, secretin, or enterogastrone.
C.
C as well.
Yeah. exactly. Yeah, so increase in basal and maximal acid output are suggestive of inflammation or removal of the proximal small intestine. So, by absence of feedback leads to increased excitatory mediators of gastric function. So, gastrin is a primary stimulus. And that's all I got.